Good afternoon, everyone. My name is Rhonda Smith. I'm the Executive Director of the California Black Health Network, and welcome to today's Health for Life series on the topic of brands, beauty, and breast cancer. So our session today is in recognition of Breast Cancer Awareness Month, and we thought it was not only important to highlight how breast cancer is impacting Black women, not just in California, but across the country. And we know that 1 in 8 Black women will be diagnosed with breast cancer in their lifetime. So we also want to make sure that we explore some potential ways that we can minimize our risk of breast cancer. So one way that we can do that is connected to something that we take for granted, that is safe, and that is hair care products and personal care products that we use every day. CBN has partnered with Breast Cancer Prevention Partners on the Non-Toxic Black Beauty Project to really build awareness and educate our community about the toxic chemicals and products that are specifically marketed to Black women and girls. And also the Safe Black Beauty Brand List, which is a list of about 80 Black-owned brands that have been vetted and tested and deemed to be safe and free of toxic chemicals. So we are honored today to have one of those business people here, a Black-owned business by a Black woman, and is also, we also have a member of the Non-Toxic Black Beauty Advisory Board, as well as a nationally known breast cancer survivor, expert, and advocate. So that's Amber Makupson, Tiah Tomlin, and Reverend Tammie Denyse. And I'm so excited about the topic today and to have these amazing women join us today. But before we start the program, I'd just like to cover a few housekeeping items. And we will hear from Reverend Tammie Denyse first, then Tiah Tomlin, and then Amber Makupson. So the chat box will be available to you to place your questions there. So if you do have any questions at any point throughout the duration of the program today, please place them in the Q&A box. The chat box will be active if you want to say hello, make a comment, give a shout out to someone that you recognize who's also on the call today or Zoom today. So please feel free to do so. So I just want to, for those of you who may not be familiar with the California Black Health Network, just give you a high-level overview of who we are and what we do. Our mission or our vision is to create a California where every African American and Black immigrant has the opportunity to live a long, healthy life free from violence, racism, and health inequities. And we do that every day through our work to ensure that all Black Californians, really regardless of how well educated they are, how much money they make, where they live, who they love, how they identify, and so on, really has access to high quality, equitable primary as well as behavioral health care, and definitely avoid succumbing to diseases, and especially those diseases that are preventable. So I am done talking for now. Next slide, please. I'm excited to introduce Reverend Tammie Denyse, who's the co-founder and president of Carrie's Touch, a nonprofit organization that focuses on breast cancer and specifically to enrich the lives of Black women diagnosed with the disease. She is an 18-year breast cancer survivor and has spent the last 15 years of that time really coaching cancer patients and their families through the trauma of a cancer diagnosis, going through the process of treatment, and then re-entry and regaining their life back after they're done with treatment as part of their journey through cancer. She's recognized as an expert in the field of breast cancer and a Black woman who is the co-principal investigator for a project called Project SOAR, which is an acronym for Speaking Our African American Realities. And that is in partnership with the University of California, Los Angeles, or otherwise known as UCLA. And Project SOAR examines the unique experiences of African American women who are diagnosed with breast cancer. Reverend Tammie Denyse was born and raised in Indianapolis, Indiana. She currently resides in Sacramento, California, is an ordained minister, a nonprofit executive, community researcher, coach, international speaker, best-selling author. There's not much she can't do. And she is the mother of 3 adult children, and I would venture to say the proud grandmother of 2 children. So without further ado, I'd like to turn it over to Reverend Tammie Denyse.
Hi, Rhonda, thank you. I did not intend for you to read all of that, but thank you for the opportunity and the privilege to be here on this very important panel. And as Rhonda said, I'm going to talk a little bit about giving you an overview about breast cancer, some of the statistics, and then more specifically about our research project with UCLA, Project SOAR. So within the United States, breast cancer incidences are about 300,000 cases per year, and about 45,000 women die annually from breast cancer. Breast cancer is the leading cancer cause of death for women. And unfortunately, Black women have a disproportionately higher incidence rate, a higher mortality rate, even though they have a lower incidence rate with our white counterparts. Black women have continued to die at approximately 41% higher rates than white women for more than 20 years. And personally and professionally with Carrie's Touch, we're saying enough is enough. We list that statistic, pretty kind of haphazardly, as if these are just numbers, when in fact these are women's lives and women who look like myself and many of you on the call today who are being impacted. And a lot of people ask why does this happen? And there are a lot of reasons, from a historical trauma with mistrust in the medical community, to fear, to myths within the Black community itself, and then some of the responsibility lies on the woman herself, for whatever the reason is. Some people also note social determinants of health as a risk factor for breast cancer, and I push back on that thought. Social determinants of health are good and they are necessary for us to understand what people are getting diseases, and why they're getting those diseases, and more importantly, what resources could be made available for them. And that's when social determinants of health are working in our favor. Otherwise, for me, it feels like it blames the victim. It blames the woman for being poor. It blames the woman for living where she lives, and it blames the woman for not having access to affordable and early care. So when we start talking about what can we do to minimize our risk, yes, we can make sure that we are aware. Yes, we can make sure that we are having these conversations. We are cultural people and we like to come together for the picnic, and we get together and we laugh and we share food and we play games. And it's a perfect opportunity for us to take the time to have these necessary conversations that could impact and ultimately help save our lives. So eating a healthy diet, a healthier diet, making sure that we are getting in exercise, making sure that we are having an adequate amount of rest. I know with my schedule, I am guilty of not getting the proper rest that I need. But if we are looking at ways to help minimize our chances of getting diagnosed with breast cancer, we have to look at our whole bodies, mind, body, and spirit, and making sure that we are doing what is good and what is necessary to improve our overall health and help minimize our risk for breast cancer, other cancers, and other chronic diseases. Some additional statistics that are California specific. In California, we have about 1,600 cases of breast cancer annually and about 320 deaths annually. Unfortunately, the disparity with mortality is the same in California as it is nationally. It's still about 40% of Black women who die from breast cancer annually. And some of the top counties that are impacted the most in California are Amador County, Calvarez County, Tulum County, Mariposa, Nevada, Lake, Trinity, Shasta, Plumas, and Marin County. And interestingly, Marin County, it's noted as being a small suburban county north of San Francisco, and it's 250,000 predominantly white, non-Hispanic residents have breast cancer rates approximately 38% higher than those in the United States as a whole. So in that very concentrated area, there is a large percentage of folks that are being diagnosed. And Black women still have a 4% lower incident rate of breast cancer than white women, but yet again, 40% higher rate of breast cancer death. And this was as noted as early as October of 2022. So, there's a lot more research that needs to be done. There's a lot more discussions that need to be had around breast cancer incidence and mortality. And one way that Carrie's Touch is contributing to that conversation is through our research project with UCLA. And that project is called Project SOAR, Speaking Our African American Realities. And what we did with Project SOAR was we wanted to hear about Black women, their experiences through their own voices. Quite often when you hear about research, you hear about researchers from an academic or a medical institution that go into various communities. They get the information that they want to answer the questions that they want answered, but they never talk to the constituents themselves about what are their concerns for their communities and for them personally. And then B, they never go back and report back what their findings were to help see if there are some viable interventions that could be put in place to help this community thrive more. And with Project SOAR, we wanted to do things differently. We wanted to disrupt the status quo. So in our partnership with UCLA, my co-principal investigator, Dr. Annette Stanton, is a white woman. And when we were creating this space, it was important for us to create an all-Black, all-woman space. So in essence, she wasn't invited into the space. They brought in a Black a research PhD student to represent UCLA, but still I didn't want UCLA out in the forefront while we were in the community talking to our women about research and understanding them and their bodies. I wanted, as a community trusted leader, to be that person that led that charge. And UCLA has been a phenomenal partner in that regard, in not only hearing my concerns as I represent the community, but standing alongside Carrie's Touch and myself as an ally and as a trusted ally to advance the data. I am a soon to be 19-year breast cancer survivor. And when I was first diagnosed with cancer, I was offered an opportunity to participate in a clinical trial. And when I asked my oncologist how were Black women responding to the trial, he said he didn't know. And I said that was unacceptable. And from that moment, almost 19 years ago until today, I have made it a part of my personal mission to not just diversify participation in clinical trials, but also helping to educate and prepare women that look like myself to participate in research on various levels and making sure that they understand what that actually means for them, and what the risk is, what the benefits are, and so they can make informed decisions about that. And then as a result of that, we went into, the project was initially launched in California. We went into Sacramento, Los Angeles, and Oakland, and we had what was called in-person gatherings. You might be familiar with the term focus groups, but again, we wanted a culturally curated space that had all Black women, and it was led by Black women in the space. So we had 4-hour gatherings. And when I first met with Dr. Stanton, she said, there's no way you're going to get people to participate in a 4-hour focus group. And I said, you're right. I said, but a 4-hour cultural experience where women are centered and valued and respected as survivors. not only will they stay 4 hours, we will have to ask them to leave after cleanup. And that happened in 2019 when we did the initial gatherings, and then back in 2023 when we came back and did a reunion. So the in-person gatherings, we had a total of 37 participants. They ranged in age from 29 to 94, and they ranged in stages from DCIS to metastatic or terminal. And what we learned from our study is that women felt that racism quite often did play a part in their experience with navigating their breast cancer journey, and lack of trust with their medical professionals. And if we looked at a concept called the strong Black woman, and we wanted to know whether or not being considered a strong Black woman had any bearing on their decision making as it related to their cancer diagnosis. And so the academic definition for strong Black woman says that it embodies and displays multiple forms of strength, psychological durability, a determination to succeed, responsibility to preserve and uplift the self and the Black community. And then the opposite side of that says embodies undisplayed stress and interpersonal strain, does not engage in behaviors that preserve psychological durability, historical legacy of racial, gender, stereotyping, and inconsistency in taking care of self, like lack of sleep, not engaging in self-care, and choosing caring for others over caring for ourselves. And so when we went in and asked those questions about the strong Black woman as it compared to their incident or their experience with breast cancer, we did find that most women said that being a strong Black woman and not knowing how to accept or receive help and support while undergoing their treatment did actually play a part in their overall well-being and outcomes, mental and emotional outcomes as a result. So one woman's words were, we do, and we keep on doing until we can't do no more. And basically what she was saying was that she was speaking as the collective in the group, are sick and tired of being sick and tired, trying to fight life, trying to fight cancer, and trying to fight all of the things that come along with it. So how does this all tie in and relate to this conversation about toxic beauty products and such? And toxic beauty products are not my zone of strength, but looking at toxic behaviors and anything that might impede our ability to live our best life, for lack of a better phrase, and to live well beyond a breast cancer diagnosis, it's looking and taking into things into consideration that are within our control. And some things that are within our control are learning to know what we need, learning to be able to ask for help, learning to know how to receive help, and learning when to say no. If we are already maxed out with life itself, with our jobs, with our churches, with everything that is important to us, and someone says you now have cancer, that's like getting a whole new life. I am giving you permission to say, time out. It's time for me to take care of me and to prioritize me so that I can not only live well afterwards, but even be here. Because ultimately, what we want to do is we want to shift that number down. We want to end the 41%. And instead of always talking about the 41%, I am going to challenge each of us as we take on some self-care and put down some of those toxic strengths, to celebrate and to talk about the 59% of us that are surviving and thriving, because we know telling us about how many of us are dying is not moving the needle. Maybe if enough of us start celebrating, then we can see that needle shift downwards, and to be able to have healthier, whole, and a greater number of Black women surviving this disease. Thank you.
Thank you, Reverend Tammie. That was amazing, as usual. I do have one quick question before we transition to our next speaker, if you don't mind. And so you said something that, well, you said a lot of things that are important, but one of the things that you said I wanted to touch on, and that's, participating in clinical trials, which we think collectively as a community have an aversion to doing. And so there's that trust factor, and rightly so, because of some of the history related to the medical community and medical research and in particular. So can you talk about kind of some of the work that you're doing to build that trust and help people understand the importance of participating in clinical trials, and especially what role that can play in, having more than that 59% of women, still here and celebrating their life?
Yeah, wonderful. Yeah, and Rhonda, I'll just go back to my personal journey, because that is really the foundation of everything that, I am trying to build through Carrie's Touch. And when that doctor told me that he didn't know how women, that were looking like me were responding to this trial, that doesn't help a person feel comfortable or feel like you have somebody on your team fighting for your life. He could tell me all the reasons how and why I could die, but he couldn't tell me how I could live. And so I participated because I wanted to shift the narrative, and I got educated. I started learning about why Black people were having such an aversion to participating in the clinical trials. And that's, some of the things that you stated. I mean, the first thing that comes up is Tuskegee. Everybody talks about Tuskegee, but most people really can't tell you the details of the Tuskegee syphilis trial. Most people don't even know it was syphilis, so they don't know what was happening in that trial. And so I challenged them to get educated and say, you can't, make life altering decisions based on partial information. If you don't even know, what stat you're quoting and why you're quoting it, then why are you quoting it? And I participated because I was informed that this was the cutting edge research. It was the latest thing on the market, and that I was not going to only have my oncologist walking with me through the journey. I was going to have the researchers and this entire NIH institution, behind me, navigating and watching me. And while I was concerned about the number of Black people that were not present in that clinical trial, as God would have it, my journey was such that it was so intense that they actually started watching me, because out of the 64 pages of possible side effects, I got about 60 pages of the side effects. So they started watching me. And, my own theory is that it's probably because I was a Black woman. And I'm not saying other Black women didn't have those responses, but that was definitely mine. But I think it's time for us to become educated, to start to build healthy patient-physician relationships, and we can have those conversations with our doctors, and learning how to have those conversations with our family members, make informed choices about what's going to be the best route for us, and participate in clinical trials so that they do know how we are responding to these drugs. And maybe we need to have different drugs for us. I don't know if that's the answer or not, but we don't know because the data isn't there.
Thank you so much for educating all of us today. And I'm glad that you said what you said, because, the reason why we created the Health for Life series and that whole initiative is to really help improve, if I can have a catchphrase, health literacy of Black Californians. And what we aspire to do through that is to make sure that individuals know what their patient rights are, right? They know how to have a conversation with their healthcare provider, no matter who or what type of provider that is. They know how to navigate through the healthcare system. They know how to advocate for themselves and their loved ones, and they know how to participate in the decision-making for their care and be well-informed to be able to make the right decision for them. And so I think all that you said today is so much in alignment with that. And we hope that, on the other side of this process of and what we're doing, that we create really a more empowered community of folks who are really taking charge and ownership of their health and wellness. And I think that if we're to see any change happen when it comes to health disparities and life expectancy, then it's going to be up to us, right, to be part of driving that change. So thank you for all the work that you do and the amazing human being that you are. I really appreciate you.
Thank you, Rhonda.
All right. And so next we have Tiah Tomlin as our next speaker. Tiah is an activist, an advocate, a cancer coach, a breast health educator and consultant, and also the project lead graduate of the National Breast Cancer Coalition, or NBCC. She developed Breast Cancer Matters, Breast Health Matters, an empowerment and educational platform for teens and women, and that serves as the program manager for the Knowledge is Power Symposium that focuses on Black women diagnosed with breast cancer. In 2019, upon obtaining the news of occurrence, Tiah opted to fight for cancer for a second time, this time around with food and faith, and she adopted a whole plant-based diet, removed harmful products and toxins from her life and her home, and added other complementary practices to her daily routine. She believes in making healthy lifestyle changes that can help improve a person's quality of life and help with better life outcomes. And she knows that helping others in their quest for optimal health is an important thing to do. And she does that as a Food for Life instructor and is now educating individuals on ways to eliminate harmful exposures to toxic things, whether they put on their body or in their body. And Tiah has advocated for survivors on Capitol Hill. She is a community advisory board member with the Bench to Community Initiative and serves as a board member and advisory board member for several pharmaceutical companies and organizations. She's a very busy woman, and I'm glad she had time to take out of her busy schedule to spend with us today. So I will turn it over to Tiah to share with us information about the work that she's doing and also more specifically about the Non-Toxic Black Beauty Project. So welcome, Tiah.
Hello, thank you. Thank you so much for having me. I really appreciate the intro, and kind of like Tammie, I wasn't expecting you to read all of that, but I appreciate you sharing the work that I've done. So I want to talk to us about making safer choices for our breast health. Again, this is Breast Cancer Awareness Month, and what we like to say is it's more than breast cancer awareness. It's also about taking action. So hopefully by the end of our talk today, that all of you will be taking action with your breast health and sharing this information wide and far with your sister circle. When we think about our health, a lot of times we emphasize the importance of the things that we're putting into our bodies, the foods that we're eating, the beverages that we're drinking, things that we consume. But we tend to forget another crucial element, and that is what we're putting on our bodies. When we look at our chemical exposures, each and every day we're exposed to hundreds of chemicals. On the average, a woman uses about 12 products a day. And we think about we think about women, but we don't tend to think about the men. But men are actually exposed to chemicals just as much. They are exposed to about 85 chemicals on a daily basis. And when we think about this, teens, they're exposed to about 17 personal care products on a daily basis. And the average child is exposed to 27 chemicals a day through their body products. Now, when we look at this, we're saying, wow, we're exposed to all of these products. But how many of those products have a whole bunch of chemicals in them? So if we were to do the math, we're exposed to quite a lot of chemicals on a daily basis. And so when we think about this, how does this impact us? And in a lot of the products that we're using, unfortunately, they have toxins or toxicants in those products. And these are actually substances that do affect our body. They can be something that's naturally made, or they can be man-made. And when we look at the health impact of them, what we're seeing is a rise of obesity. We're seeing fertility problems. We're seeing more allergies that are coming about. We're seeing some chronic illnesses, severe chronic illnesses, such as breast cancer, preeclampsia, low birth weight. We're seeing all of these types of things that are happening in our society. And alongside these things that are happening, we're also seeing a rise in the number of chemicals that are actually being used. And so, science is, there's been research that have shown that there's some kind of correlation between the rise in the chemicals that are being used, as well as the health impact. And so we're asking the question, where are these things found? Well, they're found everywhere. pesticides in our foods, plastics, our clothing, our water, personal care products, cleaning products, you name it, it is found everywhere in our environment. And you're probably saying, well, if it's everywhere in our environment, what can we do about it? I mean, we can't get away from it, right? Well, while we may not 100% get away from it, what we can do is find ways to lower our risk of exposure. And so how are we exposed? We're exposed through things that we eat, things that we drink, our skin, and breathing, just simply breathing the air that's around us. So I want to share a few things with you that's really important. What scientists are now finding is not only the exposure is a problem, but it's the timing in which we're exposed to these harmful chemicals that can actually lead to some of these issues that we're seeing here. And so when there's prenatal development, we're looking at childhood, puberty, pregnancy. These are times in which our breast tissue is very, very vulnerable. And so the more we get exposed to these things, the greater the risk for breast cancer becomes. They've also identified that Black women, we spend twice as much on skincare than other non-Black women. And unfortunately, we have the highest toxic load. And when we look at our products that we're using, we're often being marketed to. And the products that we're being marketed to, they have some of the most worrisome ingredients in these cosmetics. Here is one prime example. I'm not sure how old everyone is, but if you remember back in the day, growing up, and even now, there was these at-home relaxers. And there was this beautiful little girl on these boxes that we looked at those boxes and we say, I want to look just like that young girl. I want my hair to be like hers. But what we didn't know is that these young girls actually did not even have relaxers. So we were being marketed to falsely, unfortunately, and these things were actually impacting us. And there are some apps that you can actually use. One is called Clearia to scan and see what's going on with that particular product. So here I've actually scanned this particular product to see, hey, what is it about this product and what makes it so bad? Well, when we look at here, and this is actually, again, the Clearia app, it shows us that in some areas, these particular chemical ingredients have been banned in other countries. And then it also tells us that it's potentially toxic, right? So again, these things are being marketed to us, but we're not aware of it. But hopefully today, that's all going to change. So what are we doing to address this? Like I said, there's some apps that are out here that you can download on your phone that will allow you to either scan barcodes, or you can actually take pictures of the chemical ingredients, and it will give you some information about whether that product is safe or not. But there's another thing that we are also working on, and something that's called the Non-Toxic Black Beauty Project. And this actually started back in 2020 at the top of when everything was going on, when there was the murder of George Floyd and Breonna Taylor. And so the Campaign for Safe Cosmetics said, we're seeing a rise in, Black products that people are talking about on social media. And there were a lot of influencers that were coming out, really recommending products, but without the education that many of those products that they were showcasing and recommending for Black people were actually had toxic ingredients in them. And so what the Campaign for Safe Cosmetics said is, we need to tackle this. This is a problem. This is an environmental injustice when it comes to the beauty industry. And so what they did is they teamed up with some other advocacy organizations, some nonprofit leaders, some scientists, and they said, we want to address this together collectively. So they established an advisory committee. And we are the ones that are the ones that they have identified to be on the advisory committee are the ones that are really focused on improving Black women's health. And so what we've identified, we've curated a list or a database of over 80 safer Black beauty brands that are created by Black people for Black people with over 800 products. And this list is continuously growing. And so the overall goal of the Non-Toxic Black Beauty Project is to really reduce Black women and girls' exposure to unsafe ingredients that are found in our beauty and personal care products. They also, in addition to that overarching goal, they want to equip Black women with tip cards and resources so that we can share on our social media platforms. Our influencers can now share this information. We can share this in our communities so that we're more educated. Because unfortunately, when you look in our communities, we have beauty supply stores everywhere. and God knows what's inside of those products that they're selling. They also want to make sure that they grow a safer Black beauty industry. Also, again, continuously raising more awareness about the Non-Toxic Black Beauty Project so that we can expand the number of products that are going into that particular database. In addition to that, there's something that's called the red list that they've created. And this is a list of chemicals of concern, things that we need to be knowledgeable about, aware about. So if they are in the products that we're using, we can make safer choices by not utilizing those products. So their goal is really to expand this list, in particular, those chemicals that are found in products that are used for Black women. But as we continue to have the conversation with the advisory council, one of the big looming questions came up is, and we've seen this in the past, is when we say these are products that are going into this particular database, if there's a product that is created by a Black person and they decide to sell, do we keep them in our database? And so that was a big question that we've been discussing amongst the advisory committee. So what we decided to do is Bench to Community and My Style Matters, which is a nonprofit organization that I'm the CEO of for My Style Matters. And I am also a community advisory member for Bench to Community. So we came together and we said, okay, what can we do to try to answer this question? And we said, let's have a focus group. Let's ask the community, what is it that they want? And so earlier part of this year, in the first quarter, in Atlanta, Georgia, which is where My Style Matters is based, we came together with Dr. Tiah, who is the person who actually founded the Bench to Community initiative. And we said, let's poll these women. So what we did is we gathered a group of women, all different ages, the ages from 43 to 58. All of the women identified as female. 70% of them identified as African-American, 10% identified as Caribbean, and 20% did not select or respond to that. And then we looked at, okay, how many people do we have that are actually cancer survivors and those that weren't? 50% of those who participated were cancer survivors. 20% were those who were in active treatment at the time. And then the other 20% did not even know about the Non-Toxic Black Beauty Project prior to the focus group. So when we looked at these, when we had this focus group, we asked them several questions. And again, we were really trying to understand who's eligible to be a part of the database. What products? Is it, does it only have to be founded by a Black individual, or is it something that's geared towards a Black individual? And again, if they decide to sell, what does that look like? And so the outcomes of this, what we saw is in theme 1, that there was a huge preference for Black-owned brands. There was also a conversation, and what we found is there was a preference not only for Black-owned brands, but to support Black communities and businesses. We also saw that when it came down to the eligibility, people were looking for product quality. So not only is it a Black-owned brand, but we also wanted to know, does it work? Is it a quality product that we can use? And not only is it a quality product, but also is it affordable? And so they said, while we want to support Black businesses for sure, definitely something for us by us, the whole FUBU concept, we also want to make sure that, hey, is it affordable and is it of quality? The other thing that we talked about in this particular focus group is we said, let's talk about the project overall. What are your thoughts about the project? Is this a benefit to you? Do you think it's something that's needed? What does that look like? And so we got the response back was, we need some type of educational resource to support our hair journeys for Black women. Many of us have been challenged with our hair journeys. And so we want more educational resources for our Black hair. We also looked at the educational resources. Not only is it important to provide those educational resources, but we also, once we're educated, now we need to start making demands for safer products. This is where policy advocacy comes into play. We need to start demanding that, but we got to educate people first so they even understand what the problem is. And then the other thing that they came out and they said, how do we get the word out? And they said there's several avenues that we should really be focused on in getting this word out. One was social media. We definitely need to, of course, continue to rely on social media, but also looking at the companies and the brands that are a part of the Non-Toxic Beauty Project, making sure that they have links on their website back to the Non-Toxic Beauty Project, not only just for their business, but also to give us the exposure that there are other products that are out there. We said newspapers that are posted outside of the store. Some of the stores have local newspapers, word of mouth, of course, local news outlets, as well as media, and even in the doctor offices in the cancer treatment centers. Those are other places that we said, hey, we want to get that word out. And then the last thing in getting the word out, we also talked about public education. What does that blueprint look like? And we said we really need to educate individuals on the anatomy of our hair. You know, in order for us to really understand the problem even more so, we really need to understand just the anatomy of our hair with a focus on our hair as well as our skin. I'm sorry, the anatomy of our body with a focus on our hair and our skin. They also said we need to talk more about hormones, helping people to understand hormones and how hormones are important to our bodies and how they work in our bodies, and the importance of stress on our bodies and those hormones. And then the last thing that they said is, you know, as we continue to get this word out, we also want to make sure that we're teaching people how to read product labels. Yes, there are apps that we need to use and they're readily available. We can teach them how to use those apps, but we also want to educate women how to start reading those labels, because sometimes we forget about those apps. But if there's something that we can do to just bring more awareness to some of the top 10 chemicals of concern, then that would be something that's really of importance. And so again, I just want to say, you know, thank you so much for for giving me this opportunity to share with our audience. This is something that's so important. And if you're interested, if you scan this QR code and you want to learn more, you can actually connect with us. And I'll also post a link in the chat. But you can connect with My Style Matters Bench to Community to learn more about the Non-Toxic Beauty Project and the work that we're doing in the community around this. And we'll also be sharing out a list with several QR codes of those different apps and resources that you can connect with so that you can start making safer choices today. Thank you.
Thank you so much, Tiah. And I guess the apps that you talked about can easily be found in the, I guess, Google, on the Google Store or Google Play, as well as in Apple.
Yes.
Okay.
Yes. Yes.
All right. Thank you very much. Yes, so moving right along. Next up is Amber Makupson, who is the founder of Marki. And Amber founded Marki in 2019 as a labor of love, self-love and self-empowerment and dedication to wellness. After suffering from a serious chemical burn from an over-the-counter beauty product, Amber was fed up with the toxic ingredients damaging so many other women in addition to herself. She used her extensive knowledge and skills as a trained esthetician and accelerated her research on botanical, vegan, and Ayurvedic ingredients to create her own line of highly effective and safe products. Amber matches crystals with her products based on the holistic benefits and energy properties of each stone. She is a native of Ohio, but lives in Atlanta now. And during her pregnancy, her daughter, Amber took on a healthy and holistic lifestyle, making her own natural remedies and beauty products. So Amber, welcome to the CBHM family, and I'm excited to hear what you have to share with us today.
Thank you. Thank you so much for having me, Rhonda. Yeah, so just kind of want to jump in. So after my experience with experiencing second-degree burns on my face, that led me to start researching the ingredients that were in products that I use every day on my hair, my body, and as well as my daughter. And, you know, we've all been speaking about the statistics. So I definitely felt a huge responsibility as a mom, as a Black woman, as, you know, someone who was an aunt to 11 nieces, that there had to be something that I could do. So I literally decided to start my own brand. At first, I sold to friends and family. And then I decided to take it full time after being in a relationship that wasn't serving me and a job career that wasn't serving me. And so the word Marki means to do something with love, soul, and creativity, and to put the essence of your work into essence of yourself into your work. And so I consider Marki a hair wellness brand, and our mission is to transform the way people think about hair care through holistic wellness and clean ingredients. So we do this by formulating our products with fair trade Ayurvedic botanicals that nourish your scalp and sustain hair growth. We also match gemstones and crystals into each product according to their energetic healing properties. Our products are free of parabens, sulfates, formaldehydes, DEAs, petrochemicals, byproduct, artificial dyes, and synthetic fragrances. Next slide, please. Next slide, please. Next slide. Next slide. So, well, the previous slide. So just a little bit about our products. As I stated before, our products are free from toxic chemicals, and we also do not use any fragrances in our products. So we use aromatherapy through essential oils. Again, we also use fair trade ingredients. We have won a Women's Health Award for our conditioner. We also won a Global Vegan Award in the UK 3 consecutive years, and we have won Best Black-owned hair care brand by the Safe Campaign for Safe Cosmetics. And then again, we use Ayurvedic ingredients and also gemstones and crystals. So as you guys know, our skin is our largest organ. And so I feel like hair care has always been left out of the conversation. So you have to think anything that we put on our skin directly goes into our bloodstream. So I feel like I'm able to educate my community through my products. I also educate through social media. I also have a blog that I do. I am also in the process of starting a nonprofit organization, the Clean Beauty Coalition, which basically is going to bring together founders within the Black community or that have beauty products so that we're able to kind of campaign together to figure out things that we can do to keep people safe for the products that we make. I feel like I agree with having Black-owned brands because, of course, a lot of us are speaking from experience, personal experience that we have, and that's why we're creating these clean products. Next slide, please. I also wanted to share with you guys a little history about Ayurveda. So Ayurveda is a natural system of medicine. It was originated in India over 3,000 years ago. And the term Ayurveda is derived from the Sanskrit word Ayur and Veda, which basically means science of life. Ayurveda translates to the knowledge of life based on the idea that disease is an imbalance of stress in a person's consciousness. So Ayurveda encourages lifestyle and natural therapies that regain balance between the body, mind, spirit, and environment. So a lot of Ayurvedic treatments include different herbs that you're able to use internally and also externally. Things like using energetic crystals and also having a balanced diet, fruits and vegetables, and eating a lot of raw fruits as well. Next slide, please. In terms of ingredients, I wanted to share one of our hero ingredients, which is actually amla. So the technical term for amla is Indian gooseberry. It is a medical powerhouse, is loaded with antioxidants. It is derived from a tree that is native of India in the Middle East and has been used in Ayurvedic medicine for thousands of years. It has vitamins and nutrients that help increase scalp circulation and stimulate healthy hair growth. It acts as a natural conditioner for the hair, and collagen is created by the concentrated amounts of vitamin C that replace dead skin cells of the hair follicles with new cells, resulting in unparalleled hair growth. Next slide, please. Here are a few tips that you guys can use to help you distinguish which products are toxin And there are also apps and websites that will tell you how toxic the products are. They have a rating system. So the first thing that I would recommend would be to check your ingredient labels for harmful ingredients, and also in your personal care and cosmetic products. The websites that I would suggest would be our website, which is cleanbeautycoalition.org. Of course, the California Health Network.org. There's Claria, which is an app, Made Safe, which is also an app that can help you, Think Dirty, and also Skin Deep. These websites and apps, they will also flag the products that are on the dirty list that you definitely should not use. I would also recommend to stay away from products that say fragrance, because fragrance in a huge term is a chemical. And so right now, there are not a lot of studies that can actually tell you what is in a fragrance. So I would personally stay away from anything that says fragrance. It's definitely could contain anything harmful, anything that says natural flavors. You definitely want to check out as well, because that is such a broad term. And again, through my research, I've also found that a lot of times, since the industry is very loosely regulated, that sometimes 80% of the ingredients that are in products are not listed on the label. So, you definitely want to make sure that you are keeping yourself safe. And I am here to answer any questions that you guys may have. You can reach out to me. I'm across all social media platforms with my first name and last name, Amber Makupson, and also Marki Haircare _. Thank you.
Great. Thank you all, ladies. And so there are a couple of questions in the chat, or actually in the Q&A box. And hold on, just let me make sure that I can read it. So one person, this is Joni, says, hello, my understanding is that chemicals in perms and hair, a color is associated with uterine cancer and may be a cause of Black women having these cancers. I guess, can you validate that, or anyone speak to that comment?
I can definitely speak to that. They're on the site for the Campaign for Safe Cosmetics. They actually have studies that have found that that information is true. And, of course, once you're going to, if something happens, you get diagnosed, there's no way to find out, because of course, a lot of times we've been using these products for years. However, studies have shown that these chemicals are linked to that and a lot of other things like fibroids. Of course, we're speaking right now about breast cancer. I mean, they're linked to a lot of issues that we're having, as Black women. So that is definitely true.
Thank you, Amber. And then the second question is from Kimberly, and she says she's wondering if any of the researchers, any of you all, have partnered with the Black Women's Health Study. She's been a participant. That study has been going on for 20 years, and at one point they added questions about hair care products that they used.
I can respond to that. I have not partnered with them. I'm very familiar with that particular study, but I will say there is a body of work that Bench to Community has done, and they have talked about the impact of parabens on Black breast cancer cells. And what they did is they took the parabens and they actually exposed them to white breast cancer cells as well as Black breast cancer cells. And when they did that, they found that Black breast cancer cells were rapidly growing. And so that is a huge indicator to say, hey, these things are putting us at a greater risk for breast cancer. But again, to your point with regards to the study, it's also called the sister study. I'm very familiar with that. Yes.
Great. So I wanted to ask a question because especially, I think you mentioned this, Tiah, the Just For Me product. And I remember, I think it was one of our colleagues who talked about that at maybe a Bench to Community forum at City of Hope, I think it was some time ago. And I was really shocked to hear that that particular product and others that are specifically marketed and made for young Black girls have more toxic chemicals in them than cleaning products. So
Yeah.
can you talk and elaborate a little bit more and maybe talk about why is that happening? Why are they allowed to do that?
Oh boy. Why they are allowed to do that. I think we just need more research. Unfortunately, there are more and more chemicals that are coming out. And when we look at the number of chemicals that are out, not all of them are being tested. We have about 10% that may be tested. And when we look at the chemicals across the board, a lot of those chemicals are actually banned in the US. I'm sorry, banned in the EU, in Europe. And so, this is a huge problem, and we need more advocacy. We need more education, which is, great that we're doing this today to bring more awareness. And when we think about our young girls, and this is one of the things that we have been doing at My Style Matters, we offer a Breast Health Matters educational program where we're teaching teen girls about breast health. And we're as part of teaching them about breast health, we're also talking about making safer choices, because their breast tissue is so vulnerable, and they're out here, they're getting makeup and putting makeup on their face, and they're playing in mommy's makeup kits, and mommy's not thinking about it. And then we wonder why these young girls are starting their cycles at 8 and 9 years old, such a young age, and then they're fully developed. And again, it's the things that they're being exposed to in addition to the foods and all the other things that we're putting our children in front of. And so these are things that we really need to just be mindful of when we go out and we shop and we're buying products for our kids, because we're, as the adults, we're the decision makers. We're the ones that are saying yes or no. Some of us allow our kids to pick out what they want, but we make the decision in terms of making the purchase. And so their health is dependent on our decisions that we're making for them. And also, as we're educating them about these things as well, teach your kids about the app. They love their techies, right? The new generation, they're really into technology. And so when you teach them something, now they have a one-up on their friends, and they will want to then in turn teach their friends as well. So,
Great. And I
And
think
just chime in really quickly, and just really speak to the percentages of ingredients that are banned in the US. So just to shed some light, so 70 ingredients are banned in US as opposed to 1,200 ingredients in the UK. So if you can only imagine the type of regulation and the type of things that we are exposed to. And I do think that my daughter is actually 14. And so I do teach her these things. And I think that educating the next generation, I think that is what is really important. And then she can teach her friends about these type of things. But I mean, the numbers are just that it doesn't even make any sense. And like I said, I feel a huge responsibility, not only as a Black woman, as a mom, but someone who's in the beauty industry, that it's time for us to start speaking up, And so, yeah, just wanted to kind of shed some light on those numbers.
Yeah. And to piggyback off what you're saying, I talked a little bit about policy. It wasn't, until recently we had some laws that were passed, but it was like 80 years before they actually passed a major law that was focused on the safety in cosmetics. And so that's a huge problem. And, we're really pushing for the Safer Beauty Bill package so that we can have more transparency in the products that we're using. Not only, for us, but even those who are the most vulnerable, like our hairstylists, like, the nail salon techs, those things are really important, because that's what they do day in and day out. They have a lot of exposure to these harmful chemicals.
Yeah, and I guess the important thing to note there, maybe the bottom line of it all, is that all of these products and the harmful chemicals are not really regulated by the FDA like other products are.
No,
So
not at all. Very,
Right.
very loosely. And we are actually fighting for that as well, to have, legislation changed. I mean, why is it not regulated? So we can just, get sick and, people are dying off and there's no one to be held responsible. I think that's pretty unfair, but like I said, it starts with us. And, at the end of the day, really educating ourselves. Like, we have to also educate ourselves so that our family can remain healthy and they can be educated as well.
And so how can people get involved in advocacy so that we can be part of driving these changes, whether it's through policy or FDA regulations or anything else that can have an impact on that?
Yeah, well, I'll jump in. My Style Matters, we're doing great work here in Atlanta, Georgia. So Amber, I'm looking forward to connecting with you, of course. But also Bench to Community, they're doing great work. Being a part of the Non-Toxic Black Beauty Project, reaching out to breast cancer prevention partners. They actually have links on their page because they're leading the charge around the Safer Beauty Bill package. But go on their website, read about the Safer Beauty Bill package, write letters to your local representatives and have conversations with them to tell them, hey, this is a problem. Some of them may not even be exposed to it or be aware that these things are problems. So, we have to continue to spread the word in our communities and rally us up so that we can then, go as I call it one band, one sound, to be able to make a difference in, our lives, because our lives matter. And we don't want to hear the next generation to have to hear those words, it's cancer, in their lifetime. Those are grueling words, and I've heard it twice. Thank God I'm here, but I do this work so that they don't have to hear it.
Thank you. And then we still have a lot I'm sure we could talk about, but I have a few more things to cover before we wrap up. And Reverend Tammie, how can people get connected to learn more about Project SOAR? And are you still enrolling people into the study, or where are you with that?
Yeah, thank you. The best way to get information about Project SOAR is through our website. Just go to www.carriestouch.org. And I'll just say, with regard to policy and legislation, while our fight isn't necessarily the beauty brands, we stand with our sisters that are always trying to make this space a better space for us. And we need more folks out there doing the work, because there are many issues out there. But when we are working with various policy and legislators, you can get in touch and find out what we are working on our website as well. And when we call and ask folks to come and testify, we want y'all to show up, because your voices matter and it makes a difference. It really does make a difference. When you're fighting for policy and you're testifying, that one of the three of us might be there testifying, but they see an entire room full of Black women waiting to come to the microphone to say your name and say that you're in support of whatever it is that we're advocating. It really does make a difference. And so where we are with Project SOAR is, after we did the in-person gatherings, we did a national online survey. And so we are just now getting back the results of that survey. And so I'm not ready to be able to share those just yet, but we are enrolling women for the next phase. And that is also going to be a national effort where we're putting together the intervention. We're not going to call them interventions, but for the sake of us just keeping things the way they're supposed to be until we can say it out loud, it'll be interventions that we will be testing with breast cancer survivors across the nation, about how we take toxic strength, how we take the strong Black woman schema and we dismantle it. We keep what's good, because some of that is good to stand on the shoulders of our grandmamas and our big mamas and our aunties and our ancestors, and then get rid of that part that's toxic, that keeps us bound. So we can, for now, it's still for breast cancer survivors only, but it's going to be good, and it will be available for women to participate across the nation. So when we reach out to you and you see the information going out, just have the women that you know and love join and sign up to be part of this groundbreaking study, because there are very few people that are doing what we are doing in the space that we are doing it specifically for Black women.
Great, thank you so much. And there is a question before we get to like a special announcement that Amber Makupson has to make. But the question is, do you have safe hair color products in your product line, Amber?
I currently don't have hair color right now, but that is something to consider. I don't have hair color right now, so no.
Okay, so, but Joni Parker, who asked the question, you can go to the California Black Health Network's website on the Black Beauty Project page, And there is a list of the 80 or so Black-owned beauty products that I'm sure one of them does have hair care or hair color products that are safe and toxic free.
Correct. So let me just chime in. So the Clean Beauty Coalition, so we are available on Instagram. And so we will also have options to where you can find, you know, Black-owned products that are safe as well. So I would also say check that out.
Great. Thank you very much. And while you're talking, you want to tell us what you have to announce?
Yes, I have a giveaway for you guys. And it looks like Kimberly Lee is the winner. And I will be sending you out a complimentary shampoo and conditioner. I believe it was the first person online. I think that is how you won. So congratulations. And if you all wanted to shop Marki, there is a code NOURISH that you can use and enjoy the products. And like I said, I'm always available and accessible, social media, email, answer any questions, just say hello. I'm here.
Great. Thank you all so much. This has been an amazing conversation today. Again, I think we could continue to talk about this for another half an hour or so, but I know we all have to get back to the rest of our day. But everybody's contact information is in the chat. You can reach out to all of us with your questions or just to connect. And if you can go to the next slide, Ambria, we can wrap it up. And so if you'd like to stay in touch with us, you can connect with us on social media, on Facebook, Twitter, Instagram, LinkedIn, and also you can check out the videos. This recording in particular will be on our YouTube channel in the next couple of days. You can join us in the campaign for Black Health Equity. We are really working very hard to improve health outcomes and the health and well-being of Black Californians, and you can be part of that process. So thank you for joining us today. We're really glad that you all were here. Hopefully you have a few takeaways and you learned some things today that you didn't know before you joined, especially about hair care and personal care products. So thank you all again for joining us today and have a great afternoon.
Thank you. Bye, guys.
Bye. Thank you.